You or someone you know has a fat lip and you're interested in knowing what to do about that. My name is Beverly Bitterman, ARNP, Health and Wellness Consultant. Well, the first thing is to figure out what caused the fat lip. So if you were outside and you were roughhousing and you knocked into something and it's like a bruise, then of course you're treating it as you would any kind of a bruise. And ice is the first line of treatment for that. So you would take your ice pack out of your first aid kit, or you would get some crushed ice and put it in a baggie and hold that onto your lip. And you would do that several minutes initially, and then say 10 or 15 minutes out of every hour for the next couple of hours. After that, the other thing to think about for a fat lip might be discomfort, and you would not want to use an aspirin product because you don't want the lip to bleed more, so you would use something like Tylenol to help with the discomfort. Now, if your fat lip is due to a pimple or some kind of an infection, then you would do almost the opposite. You would put warm, moist heat on that. So you would take a washcloth, run it under hot water, and then hold that on your lip for several minutes, an hour, or several times a day, depending on your work schedule and how fresh this is. If you don't know why you've got a fat lip, there are some medications, some antihypertensives, for example, that can cause what we call angioedema. And in that case, if you have an antihistamine around, you could try that. Benadryl, for example, you of course don't want to drive if you're taking an antihistamine. But if you've got a fat lip and you don't think it's a bug bite or a bruise, I really recommend that you see your doctor and have them evaluate that, as well as evaluating your medications. So I hope those are some strategies to deal with different kinds of fat lips that you might encounter. My name is Beverly Bitterman, ARNP, Health and Wellness Consultant, and I hope that your lip goes back to normal right away.